Cavities are permanently damaged areas in teeth that develop into tiny holes. Now, the causes include bacteria, snacking, sipping sugary drinks, and poor teeth cleaning. Though there may be no symptoms, yet untreated cavities can cause toothache, infection, and tooth loss. Dr. Oluwatobi Oduba, a dentist, joins us virtually for more. Thank you for joining us, Doctor.
Thank you very much. Good day.
So let's start from the very beginning. What is dental cavity?
Okay. Dental cavities, they are decayed or damaged parts that have been permanently damaged parts of your tooth and this has occurred due to demineralization, which is loss of certain components that make up your tooth. And this initially starts as a white discoloration, and it eventually, if the process is not stopped, it becomes a small hole that becomes wider and wider over time and eventually destroys your tooth.
All right, you said something now. You said if the process is not stopped. What process are we talking about here, and how do we stop that process?
Okay, so the process of dental decay or cavitation, it actually starts when we have something called plaque. Is the mouth bacteria is a film that when immediately you are done brushing, it usually comes on your mouth. You sometimes you put on your when you put your tongue around your teeth, you feel something like a slimy part of your saliva. It's a natural occurrence. It happens to everyone. Everybody has normal mouth bacteria. But if the mouth bacteria, if the mouth bacteria finds something like carbohydrates or food substances for it to act on that is on top of the tooth, and this mouth bacteria acts on the food surfaces, on the carbohydrates or sugars that is found on the tooth. This particular stuff actually makes the tooth lose some particular ions, that's calcium and phosphate ions. Your tooth is made of calcium and phosphate ions and some other ions actually. But when this acid makes you lose these particular ions, it will make you start having holes in the tooth. And this process can actually be stopped if you brush very well, brush morning and night, and you can actually arrest this particular decay process. Or you go to a dentist. If a dentist sees that, okay, yes, there's something going on, that this tooth is about to have a hole, there are preventive measures that they can actually put in place to stop it. One preventive measure they can put is there's something called fluoride. It's the constituent of your toothpaste. In the dentist, we have professional fluoride therapy, in which we'll put like a very high quantity of fluoride. We'll apply it on that particular teeth, and the ions that the tooth is losing, it will gain them back. That's one method. Another method, they can actually cover up those places that are about to have holes, so the process would actually stop.
All right, so talk to us about the risk factors. Also, is it age specific?
For dental cavities, I would like to say that everybody can have dental cavities. Anybody can have it, but usually for some particular climates, they see it in younger people, in younger adults, and old elderly people that they're not really they can't really take care of their teeth well. They see it in children and they see it in younger adults. But I would say that personally, anybody can have it. It depends on how you treat your teeth. There's no particular treatment there's no particular factor that separates one from having it and one from not having it. Anybody can actually have dental cavities. And the risk factors, there are actually a lot. First is not brushing. There are some people, they don't brush well, and they don't brush well. It's recommended for you to brush twice daily, morning and night. In the morning, after your first meal, and at night, when you're about to go to sleep. It's actually recommended for you to brush twice daily. This process actually stops it. A lot of people, they don't brush, and two, they don't even brush well. We usually try to teach when patients come into the dental clinic, into the dental setting. We usually try to teach people how to actually brush properly. Because a lot of people, they don't brush the parts that actually are prone to having holes. Another risk factor for actually having dental cavities is frequent snacking. When we actually notice that a lot of people that they take a lot of snacks, of these soft drinks, a lot, they are very prone to having dental cavities. Because as I explained earlier, the whole process of the cavity is when there's a constant attack on your tooth by the acid and bacteria in your mouth. And this process will actually frequently occur if you consistently take or frequently snack during the day. Like the whole process is happening so many times during the day, and this will make you prone to having cavities. So risk factors for having cavities: one, not brushing, through not brushing well, not brushing the appropriate places. Three, frequent snacking and snacking in between meals. That can actually be one of the main causes of having caries, which is cavities.
So are there different kinds of cavities?
Yes. So there are different kinds of cavities. There are like 4 stages. The first stage of a cavity process is a discoloration of your teeth, which is a white discoloration of your teeth. That's the first process. And this process can actually be stopped, as I said earlier, by using fluoride and brushing well. The process can be arrested. Then the second process is when there's an actual hole in the top surface of your teeth, which is the white part of your teeth. That's your enamel. This is called enamel caries. So at this particular point of your teeth where you have a hole in your teeth, they can put a filling on, they'll drill out the dirty part, the decayed parts, and they'll put a filling on this particular part of your teeth, and you're fine. Then the second process, if this process is not stopped at the enamel stage, there's the dentin stage, which is deeper into the tooth. At this point, the tooth can be saved. After taking an x-ray, if the dentist says that, okay, yes, it's still at the dentin, the dentist they will put a medication on that particular part of your teeth before putting a filling on it to protect the nerve. Then if you don't go to the dentist, all this process is not arrested, you will get deeper, it can go to the nerve of your tooth, which is the pulp. The dental pulp is the fourth part actually. Once it gets to this particular part, you will notice that patients will come, they'll start that they're having serious pain, they're having headaches, they can't sleep at night, so much pain, and they could even be swelling self that there'll be pus discharge from that particular part. So this is, as I said, this is the final stage. At this particular point, they'll need to remove the nerve of the tooth and do a treatment called the root canal therapy before putting a filling and a cap on it, or they will remove the tooth. It depends on how bad and how decayed the tooth is. So as I said, there are 4 stages. First stage is the white discoloration, then the enamel stage, the dentin stage, and the pulp.
So how exactly can we prevent dental cavity?
I will list prevention based on for children, for young adults, and for adults actually, and for the elderly. So for young children, ideally, as soon as your child starts having their teeth, as soon as your baby starts having your teeth, you should take them to the dentist for a dental checkup, because it has been found out usually is something that is frequently seen that children, when they give them, there's something called feeding bottle caries or cavities. Overnight, a lot of mothers will put the feeding bottles into their children's mouth and they'll leave it overnight. And then we notice that overnight, the bacteria and the acid would affect the teeth and they will have holes. So you'll usually see some children that have a lot of holes in their teeth. So as soon as the child starts having teeth, you bring them to the dentist. For them at a young age, for the baby age, we will usually do something called fluoride therapy. We put high quantity of fluoride on another particular part, and that can prevent them from having holes. Now, for young adults, or for you that you're just starting out to have your permanent teeth that are just coming out, for children actually, between from like from age 6 to 11 or 13 years old, you start having your milk teeth coming out and your permanent teeth coming out. Prevention. First, you have to make sure that you're brushing twice daily, morning and night. Reduce the way you snack, take a lot of chocolates, sugar, soft drinks. All these, they demineralize and they make your teeth lose the ions that are essential for you not to have holes. And also, another important thing is for you to get the dental floss. There are a lot of dental floss that they sell these days, but it's the rope part that we usually emphasize for patients to use to put in between their teeth and to bring out whatever dents they are having between their teeth. So it's recommended for you to floss daily, brush twice a day. And one important thing that is not done in our particular climate is the fact that a lot of people don't use fluoridated toothpaste that contains fluoride. Most or some herbal toothpaste that are commonly sold, they do not contain fluoride. And fluoride is an important, if not the most important part of your constituent of your toothpaste that prevents you from actually having holes. So if this constituent is not in your teeth, you are prone to having a lot of holes. So I would recommend for everybody, make sure that if you are buying the toothpaste, it contains fluoride. Then for young adults that are just having their permanent teeth coming out, there's a particular treatment that dentists do that they cover on the back of your teeth. For children that are prone to having caries or cavities, there's a treatment called fissure sealants in which we cover the surfaces of those back teeth to prevent them from actually having holes. That's the treatment. And also they can do fluoride therapy. While for adults, same thing applies. You brush twice daily, morning and night. And also you reduce the snacks that you take at different times. And also for adults too, you need to floss and make sure that you go to a dentist. Ideally, everybody should see a dentist every 6 months, because most times when you start having holes, you might not even feel anything. You might not feel any pain. You might not even know that anything is going on. If you go to a dentist, the dentist will actually be able to detect all these things, clean your mouth for you. Scaling and polishing is actually very, very important.
So when you say we should clean our teeth regularly, are you referring to scaling and polishing?
Yes, I'm talking about scaling and polishing. The scaling and polishing should be done every 6 months or at least once in a year if you are not chanced.
Now talk to us about, the expected symptoms of dental cavities.
For the symptoms, at first, you might not feel anything. But as it progresses, some patients notice that they feel sensitivity when they take cold drinks or hot drinks.
All right, talk to us. What are the likely complications for people living with dental cavities?
So firstly, is intense pain, kind of pain that you can't sleep at night. I'm sure a lot of people that have had dental pain, they've been able to testify that it's one of the worst pain. A lot of people say that it's probably worse than labor pain.
No way.
They could have severe pain.
Okay, now are there signs that should make you rush to the hospital, like signs that must not be ignored?
The moment you feel pain or the moment you feel sensitivity from that particular tooth is the point where you run to your dentist.
Okay, thank you, doctor. Let's have your part in short.
So for closing, I would advise every patient or everybody is a potential patient, including me. I would advise everybody to brush twice daily, morning and night. At night, last night at night, and in the morning, immediately after your first meal. That's my first advice. My second advice would always be to visit your dentist at least once a year or twice in a year, just for your regular cleaning. During your regular cleaning, the dentist might be able to identify 1 or 2 problematic areas that need to be addressed before it eventually becomes a big cavity, or you might actually notice a very tiny hole that can actually be filled before it actually progresses. So those would be my 2 take points. Brush twice daily, floss also, and also you should visit your dentist at least twice in a year or once in a year.
Well, we've been speaking with a dentist, Dr. Oluwatobi Oduba. Thank you for joining us today, and do enjoy the rest of the day. My name is Perpetua Fasami Peter. Bye for now. See you again next week.